Visceral fat is not the fat you can pinch. It's not the fat under your skin. It's the fat that surrounds your organs, and it's the most dangerous type of fat in the body. Visceral fat wraps around the liver, pancreas, and intestines. It interferes with hormones, drives insulin resistance, increases inflammation, and dramatically raises the risk of type 2 diabetes, heart disease, fatty liver, and metabolic syndrome. This is why two people with the same body weight can have very different health outcomes. One may be metabolically healthy, the other may be at high risk. The difference is often visceral fat. In this video, you'll learn the fastest way to shrink visceral fat according to science. Not detoxes, not extreme diets, not quick fixes. You'll understand what visceral fat really is, why it accumulates, why some people lose belly fat but not visceral fat, and which strategies actually reduce it. And later in this video, we'll talk about the mistakes that slow visceral fat loss, even in people who are eating clean and exercising. Let's start with the foundation. Visceral fat is hormonally active tissue. It's not just stored energy. It releases inflammatory molecules, disrupts insulin signaling, and alters appetite regulation. This is why visceral fat is more dangerous than subcutaneous fat. And this is also why shrinking visceral fat requires metabolic change, not cosmetic change. Now, here's the most important truth. You cannot target visceral fat with spot reduction. You reduce it by changing the metabolic environment that allows it to exist. So, what creates that environment? The biggest driver of visceral fat is chronically elevated insulin. Insulin is a storage hormone. When insulin is high, fat storage is prioritized. When insulin remains elevated for long periods, visceral fat accumulates. This happens not just from eating sugar, but from frequent eating, refined carbohydrates, constant snacking, and metabolic stress. This is why many people exercise daily and still carry visceral fat. Exercise alone does not override insulin-driven fat storage. Now let's talk about the fastest lever science has identified. The fastest way to shrink visceral fat is to reduce insulin exposure. Not starve. Not eliminate all carbohydrates. But reduce the frequency and intensity of insulin spikes. This starts with dietary structure, not just food choice. Constant grazing keeps insulin elevated all day. 3 structured meals with adequate protein and fiber allow insulin to rise and fall. This single change often reduces visceral fat before the scale moves. Now let's talk about sugar and refined carbohydrates. Visceral fat is especially sensitive to fructose and refined carbs. Fructose is processed primarily by the liver. When intake is high, the liver converts it into fat, much of which ends up as visceral fat. This is why sugary drinks, fruit juices, and ultra-processed foods are strongly associated with visceral fat accumulation. Reducing added sugar is one of the fastest ways to reduce visceral fat, not because sugar is evil, but because of how it affects liver metabolism and insulin signaling. Now let's talk about protein. Protein is one of the most powerful tools for visceral fat loss. Protein increases satiety, stabilizes blood sugar, reduces cravings, and supports lean muscle mass. Muscle tissue improves insulin sensitivity, which directly reduces visceral fat storage. Higher protein diets consistently show greater reductions in visceral fat compared to low-protein diets, even when calories are similar. But timing and distribution matter. Protein works best when it's included at each meal, not concentrated in one. Now let's talk about calories. Yes, energy balance matters, but visceral fat is more sensitive to hormonal balance than total calories. This is why some people lose weight but not visceral fat. They reduce calories but keep insulin elevated. Visceral fat responds best to mild caloric deficits combined with insulin reduction, not aggressive restriction. Now let's talk about exercise. Exercise helps, but not all exercise works equally for visceral fat. Resistance training improves insulin sensitivity by increasing muscle mass. Cardio improves fat oxidation and metabolic flexibility. But the most effective approach is combining both. High-intensity interval training has shown particular effectiveness in reducing visceral fat because it improves insulin sensitivity and metabolic signaling. However, excessive training without recovery can increase cortisol, which promotes visceral fat storage. This is why more exercise is not always better. Now let's talk about sleep. Sleep deprivation increases cortisol and insulin resistance. Both drive visceral fat accumulation. People who sleep less than 6 hours per night consistently show higher visceral fat levels, even when calorie intake is controlled. Improving sleep quality often reduces visceral fat without any change in diet. Now let's talk about stress. Chronic stress increases cortisol. Visceral fat has more cortisol receptors than subcutaneous fat. This means stress preferentially feeds visceral fat. This is why belly fat often appears during stressful periods. Even without dietary changes, stress management is not optional for visceral fat loss. Now, let's pause here. At this point, many people are doing most things right and still struggle. Why? Because they focus on weight loss, not metabolic repair. Now that you understand what visceral fat is and why it accumulates, it's time to talk about how to shrink it as efficiently as possible, based on what human physiology and clinical research actually show. Because visceral fat does not respond to shortcuts, it responds to metabolic signals. Let's start with an important clarification. There is no single hack that melts visceral fat overnight. But there are strategies that consistently reduce it faster than others, and they all work by improving insulin sensitivity, hormonal balance, and metabolic flexibility. The first powerful lever: meal timing and structure. One of the fastest ways to reduce visceral fat is not changing what you eat, but how often you eat. Frequent eating keeps insulin elevated. Elevated insulin blocks fat release. When insulin remains high, visceral fat is protected. This is why structured eating patterns work so well. Most people see improvements when they move from constant snacking to 3 structured meals per day, each with adequate protein, fiber, and fat. This allows insulin to rise, do its job, and then fall, creating windows where fat can be released. You don't need extreme fasting to achieve this. You need predictable metabolic rhythm. Intermittent fasting can accelerate visceral fat loss for some people, but only when done correctly. Fasting works by lowering insulin exposure and increasing fat mobilization. However, fasting is not magic. If fasting increases stress, disrupts sleep, or leads to binge eating later, it can backfire by raising cortisol. The best fasting approaches are gentle and consistent, not aggressive. For many people, a 12-14 hour overnight fast is enough to see improvements in visceral fat markers without excessive stress. Protein remains a cornerstone. Protein deserves emphasis again because it plays multiple roles. It reduces appetite, stabilizes blood sugar, preserves lean muscle, improves insulin sensitivity. People with higher protein intake tend to lose more visceral fat, even when weight loss is modest. This is because muscle tissue acts as a sink for glucose, reducing the need for insulin and lowering fat storage pressure. Aim to include protein at every meal, not as a supplement, but as real food. Carbohydrates. Quality over quantity. Visceral fat responds strongly to carbohydrate quality. Refined carbohydrates and sugars spike insulin quickly and repeatedly. Whole food carbohydrates, vegetables, legumes, whole grains in appropriate amounts, digest more slowly and produce a lower insulin response. Reducing refined carbs while keeping fiber intake high is one of the fastest dietary changes for visceral fat reduction. This is not about eliminating carbs, it's about choosing the right ones. The underestimated role of fiber. Fiber plays a direct role in visceral fat reduction. High-fiber diets improve insulin sensitivity, reduce inflammation, and support gut health. Soluble fiber in particular slows glucose absorption and reduces insulin spikes. People who increase fiber intake consistently lose more visceral fat over time, even without major calorie restriction. Fiber feeds beneficial gut bacteria, which also influence fat storage and inflammation. Exercise. Quality matters more than volume. Exercise reduces visceral fat even without significant weight loss. But not all exercise works the same way. Resistance training improves muscle mass and insulin sensitivity. Cardio improves fat oxidation and metabolic health. High-intensity interval training has shown particular effectiveness for visceral fat reduction, but only in reasonable doses. Overtraining increases cortisol, which feeds visceral fat. The goal is stimulus, not exhaustion. 3 to 5 sessions per week of mixed resistance and moderate to high-intensity cardio is sufficient for most people. Sleep, a non-negotiable factor. Sleep is one of the strongest predictors of visceral fat. Even 1 week of poor sleep increases insulin resistance and cortisol levels. Chronic sleep deprivation makes visceral fat extremely resistant to loss. Improving sleep duration and quality often leads to measurable reductions in visceral fat, even without diet changes. This is why no fat loss plan works without addressing sleep. Visceral fat has more cortisol receptors than other fat tissue. This means stress hormones preferentially increase visceral fat storage. People under chronic stress often store fat centrally, even when calorie intake is controlled. Stress reduction doesn't require eliminating stress. It requires improving recovery. Breathing, consistent routines, physical activity, and adequate sleep all reduce cortisol signaling. Alcohol directly promotes visceral fat accumulation. It increases liver fat, disrupts insulin signaling, and raises inflammation. Even moderate alcohol intake can slow visceral fat reduction. Reducing alcohol is one of the fastest ways to improve visceral fat markers. Some supplements may support visceral fat reduction indirectly by improving insulin sensitivity or inflammation. However, no supplement replaces dietary structure, sleep, and movement. Supplements should support the foundation, not distract from it. This is a critical question. Visceral fat often decreases before visible weight loss. Improvements in insulin sensitivity and liver fat can occur within weeks. Visible changes may take months. The scale is not the best indicator early on. Better signs include improved energy, better blood sugar stability, reduced waist circumference, improved lab markers. Let's summarize the mistakes that slow visceral fat loss. Eating too frequently, focusing only on calories, ignoring sleep and stress, overtraining, relying on detoxes or supplements, expecting linear progress. Visceral fat responds to metabolic consistency, not intensity. Visceral fat is not stubborn because you're failing. It's stubborn because it's hormonally protected. When insulin, cortisol, and inflammation decrease, visceral fat loses that protection, and when that happens, reduction becomes steady and predictable. The fastest way to shrink visceral fat is not extreme dieting, it's restoring metabolic balance. And once that balance is restored, your body does what it's designed to do.